Hello and welcome to another interesting episode of 101. My name is Elsie Godwin. Here with me is Dr. Nesochi Okeke-Igbokwe, who is a New York City-based physician, health and wellness expert, media contributor, speaker, and blogger. During the course of this conversation, if time permits us, we hope to touch on all there is to depression and social media addiction. Thank you for joining us on 101.
Thank you for having me.
Okay, so you see everybody talking about depression right now, like it is a movement, right? What exactly is depression? I know it's a form of mental health, mental illness, but what exactly is depression?
Depression is a mental health disorder, and it's characterized by certain symptoms that one would have for a certain amount of time. So some of the symptoms that you look out for to diagnose a depressive state would be a low mood or low energy all the time, having irritability most days than not, also just feeling sad and low all the time. Also, people who experience depression, they have issues with feeling guilt and feeling hopelessness and worthlessness. You might also see changes in their eating patterns. They may lose a lot of weight or gain a lot of weight. You may see also changes in their sleeping patterns as well. They may oversleep. But basically, they are in a low kind of energy state at most times. And usually, when it's diagnosed, people or the medical world thinks that it is due to somewhat of a chemical imbalance of sorts, and that's why it's treated with certain kind of antidepressant medication to help bring back the neurotransmitters that make you feel better and not so low.
Okay, you know, these things you mentioned as the symptoms are things you could say someone not exactly suffering depression might have them once in a while, right?
Yeah.
So for how long should it occur, or how do I really know that this feeling has become depression and not just you feeling sad because you're broke or because you lost your job or because you're heartbroken? When do you understand that this is now full-blown depression?
So when things happen to people all the time, so you may have times when you feel a little low or a little sad, but this is a continuous pattern when you have a depressive disorder. It lasts for weeks when you're experiencing those symptoms that I described.
Okay. So for how long? 2 weeks, 1 week, a month?
It can be anywhere from 2 to 6 weeks continuously and just continues to progress. But one major sign I forgot to mention that would be telltale that you do have a serious depressive condition is that one might have suicidal ideation, meaning thoughts of self-harm, thoughts of wanting to basically end your own life. When you get to that stage, at any point, you know that there is a serious issue at hand.
What are the causes of depression?
So depression can occur for various reasons. Sometimes it can be secondary to the side effect of certain medications. Certain medications can give the onset of depression. But for the most part, when people do start feeling depressed, it is sometimes due to that chemical imbalance of the neurotransmitters. Other times, it can also have a genetic component as well. Sometimes if you do have family members, first-degree family members who experienced serious mental health disorders and experienced depression, sometimes it is genetic as well, and you can get depression as well.
So we hear people say depression is not a Nigerian thing. This is not the kind of illness we go through here. It's the foreigners, you know, it's imported. Is there a race or tribe for depression?
Okay, let's just put it out there. Depression does not discriminate. Anyone can become depressed. And I think that brings to light a major issue here in Nigeria. There's such a taboo, a stigma, I should say, around depression. If anyone says that they have depression, they're now kind of isolated and ostracized from society, and there's just a negative tone and a negative just negative words that are placed on anyone who is experiencing depression, which makes it hard for somebody who is truly suffering to really get the help that they need. So what we need to do is continue to have these discussions about what it is and make it okay for people to come out and speak about the problem when they do have it, because one of the worst things people can do is really suffer in silence and feel like they have nowhere to go, no one to turn to, and no one to actually talk to about these feelings. Bottling it up doesn't make it any better.
Okay, I'd like to talk about the forms of depression, but before that, social media is here, right? And so many people have attributed social media to being the cause of some level of depression. What do you think about that?
You can't fully attribute social media to causing depression. But with that said, there are research studies that show that there is somewhat of a correlation. Is there a causative effect? Can we say that going on social media causes you to be depressed all the time? Not necessarily, but what we do see is that those who are on social media for longer periods of time, if you're spending a lot of time, excessive time on social media, and if you're using an increased amount of social media platforms, that does put you at an increased risk to feel some of the symptoms of depression, to feel loneliness, to feel anxiety, and to feel low and down.
Okay, so it could become a trigger.
It can become a trigger for some. If you're somebody that's already prone to depression to begin with, and you're on social media all the time, that can trigger a few things. And it also depends on how you're using social media as well. What are the reasons that you're using social media for? Those things are all important to keep in mind. Okay,
let's talk about how this sickness is diagnosed, right? Because I see so many people just come up to say, I think I'm depressed right now. And you also see somewhere in that caption, I think I'm sad. So it's a case of going through something or going through life. Probably life is a bit tough at that point, and then the post just goes out there, I'm depressed. So how is this depression diagnosed? Is it something I can wake up and tell myself I have depression?
If somebody feels that they have depression, the first thing I recommend is talk to a medical professional. The medical professional will actually diagnose the disorder. Usually if you're speaking to your primary care doctor or more so a psychiatrist, after talking to you, giving you a series of various questionnaires to complete, then they can make that clinical diagnosis based on certain symptoms that you may or may not be having. So it's not to brush off somebody who says, I'm depressed, and say, no, you're not. But it is to say that if you do think that you have depression, you need to seek help immediately and talk to someone in the medical field about it.
So what are the stages of this illness?
Stages of depression. Okay, so when we're talking about depression, the major thing that you're going to see are the symptoms of hopelessness and helplessness and sadness. Basically feeling depressed or having a low and sad mood most days than none. You'll have the feelings of feeling empty, guilty for no reason, feeling that there's no reason why you want to sometimes be in the world anymore. Another thing that is notable is that the things that you used to enjoy doing, you don't enjoy them anymore. So if you're somebody who used to enjoy, let's say, writing poetry all the time, that was your joy, that was your passion, you just don't want to write, you just don't want to do anything. You see a huge change in your behavior and your mood from prior, essentially. One thing to note and understand that there is an issue at hand is when it's difficult for you to go about your day-to-day living.
But when I say stages, I know there are some medical terms that will tell you, oh, your depression is still mild, or you've gotten to a state where you need almost 24 hours attention. So are there terms like that keeps this depression illness in stages? So if you're talking about acute emergencies, the main emergency is if somebody has suicidal ideation. When it gets to a point when somebody says, I no longer want to live anymore, and they have an active plan, meaning that they've thought through what they want to do to harm themselves and end their lives, that is a major psychiatric emergency, and they would require inpatient evaluation and treatment. So substance abuse, let's just delve into that, because sometimes when people are depressed, they decide to use substance to probably get themselves, since you talked about being low, they want to just get to a high stage, right? So how does this work hand in hand? Just touch more on substance abuse. So
some of the connections that you see with substance abuse and depression, there are sometimes comorbidities that you kind of see hand in hand. Sometimes when patients are depressed, they will use various substances to kind of try to self-medicate. A lot of the times with certain medications or illicit drugs, it can give patients or anyone under the influence a certain high that kind of removes them from whatever issue or problems they feel that they're experiencing in the world, to try to give them that escape that they want from the reality of this world. So sometimes you will see patients that do have depression delving into the world of substance abuse, illicit drug use, and whatnot.
So how is depression treated?
Depression, the mainstay treatment for depression is what we call SSRIs. It's a class of antidepressant medication, selective serotonin reuptake inhibitors. And basically the mechanism of action is to pretty much increase the amount of neurotransmitter in the brain that's thought to be lower when you are depressed. So there are different classes of antidepressant medications, but based on whatever you're going through and your profile and other health conditions, your doctor or psychiatrist may determine what kind of medication they want you to be on. Another therapy that's used for depression is basically cognitive behavioral therapy. Sometimes patients undergo what we describe as talk therapy, speaking with a psychiatrist or psychologist about what exactly is going on and the things that are kind of triggering some of the issues and how to make day-to-day living doable.
Okay, so is depression preventable?
Is depression preventable? So there are things that you can do to make it, I guess I should say, less likely that you are going to go into a depressive state. Okay. So avoiding being isolated all the time, being around people, talking about your feelings and emotions. It puts the word out there that there can be something going on. But with that said, there are people who you would still not know, even if they're...
Yeah, I was going to say that. I mean, there are people we've seen that are very active, very cheerful for the life of the party, and then suddenly you hear they try to commit suicide. So does that really prevent anything?
I mean, it's not necessarily saying that that's preventative, but there's no 100% surefire way that you can prevent anything like that from happening, but you do take the measures to lower the likelihood of these things happening. Okay,
so let's talk about people around someone suffering from depression. I know as much as we want to take care of our own mental health, it is enough responsibility trying to take on someone who is going through the depression states. How do we handle it if you don't understand it? How do you say things that you're supposed to say and not say things that will trigger this person?
So one thing to do is to really be understanding. Don't be so judgmental if you do note that somebody is having a problem. Okay. And also just be there to actually listen to them. There are certain things that they may say or do that can be a red flag that something is up. You may see some changes or changes in the patterns of their behavior, and that would be a red flag to just really be there for them and just have that open and honest discussion about what's going on. My point about not being judgmental, oftentimes when you make somebody feel that there's something really wrong with them, it makes them want to kind of internalize and bottle in what they are going through. So somebody who's depressed needs to have somebody that they can trust to actually talk about their feelings and talk about their emotions. They need a go-to person so that they have that support system that they need to go on about their day-to-day life.
How often does depression lead to suicide?
That's really hard to say how often it's going to lead to suicide, but one thing to note, if somebody has a plan, that's one thing we always talk about in the medical community. If somebody has suicidal ideation and they actually have an active plan, it's more likely that they are going to go and try and fulfill that plan. So if they're talking about, oh, I want to end my life by doing X, Y, or Z, then that's a huge cause for concern. Okay,
let's talk about relationships, right? Because I just mentioned how people around them handle it. But when a depressed person goes into a romantic relationship, how can the significant other, I mean, it's clear this person is suffering from depression. How do you be the best partner for this person?
Okay, first and foremost, you have to make them realize that it's okay to open up, and if they need help, help them get to that source of getting the treatment that they need. With that said, I mean, by going to see your primary care doctor or psychiatrist.
Okay.
A lot of the times, like I said, people don't want to talk to a mental health professional or a medical professional about their depressive symptoms or their state because it makes them feel like, you know, they're going to be ostracized by the rest of society. So I think if you are in a romantic relationship, make your partner aware of the fact that it's okay to get the necessary treatment.
Okay.
Because sometimes, even if you are a support system for them, sometimes that just is not enough. Sometimes you do need that psychotherapy. Sometimes you do need that medication to help.
Okay, let's take it away from depression a bit to go into mental health proper.
Okay.
What would you advise anyone to do? Let's say, okay, give 3 tips on how to properly, like you said, it's not totally preventable, right? But how can one take care of the mental state?
Okay. So taking care of your mental state is something that you can do on a day-to-day basis.
Okay.
Is what we call self-care. Doing those things that can keep you upbeat in a more positive mood and just help your overall state of well-being. One thing that you can do that's key that you should be doing anyways is exercise. Exercise is good for the body and it's also good for you mentally as well. When you exercise, you have a whole lot of neurotransmitters and hormones like endorphins that are released into the brain that make you feel better. So that's one thing that you can do to feel better and boost your spirits. Also, another thing that you can do is meditate or pray. There have been, you know, studies that have associated meditation with increasing your mood and well-being. The last thing I would say is really just find those activities that bring you joy or things that once brought you joy in the past, whether it's singing, dancing, engaging in a sport, just anything that you recognize that has brought you that kind of happiness in the past. Try to engage in those activities and try also not to be so isolated when you're engaging in those activities.
Okay. Let's talk about praying. You mentioned praying. And I know we're just talking about preventive measures, but we've seen cases of people suffering depression and then someone says, just pray. If you have faith in God, this would not happen. How would you address that? So, because we understand that sometimes there is that need for medication, yes, of course, spirituality and prayer are great. However, there are times that you may not be able to, quote unquote, pray away medical conditions. Okay.
Okay. So with that said, spirituality, prayer, those are wonderful things, but you should also seek treatment as well.
So depression is not a form of evil spirits?
Glad you brought that up. It's not a form of evil spirits by any means.
Okay.
It's a mental health disorder, and we need to basically call it exactly what it is. It's a psychiatric condition which people need to get the help that they require. There are no spirits or evil demons or witches or anything that are taking over the body. That's one of the myths that I've heard here in the country about the causes of depression.
Let's talk about social media addiction.
Okay.
I mean, we always go back, right? Why do you think so?
So a lot of the times when people go back, it's because there's an activation of reward pathways in the brain. Usually when we talk about any kind of addiction, what usually happens is that these reward pathways can increase the amount of neurotransmitters like dopamine that make you kind of feel good and happy. So it's rewarding when you go on social media and you see that you're getting lots of likes or followers. So for some people, that can be a trigger, that can be the reward to want to go back for more and more and more.
But you know, there are people who are not necessarily getting these likes and followers, but they're just there. Consuming content, watching people, giving these followers
Of course,
some likes.
absolutely.
So what is their reward?
So for them, it's just feeling that they are a part of something and they're not missing out. I'm not sure if you heard of, FOMO, fear of missing out. Lots of times people go back for more and more because they feel like in their own life outside of the internet, maybe there's something in the internet that they're missing out on. So they have to go back and kind of see what everybody's up to and, keep abreast of things in that way.
Do you think the idea of social media being very mobile is one of the reasons for addiction, because you can carry it everywhere?
Of course, the rise of basically mobile technology just makes it easy to access anything just at a click of a button. Smartphones, they basically change the way we communicate worldwide. So I think that is a contributing factor for that easy accessibility to anyone at any time.
This easy accessibility, how is it affecting our physical health generally?
Physical health in general. So there are a few things that happen when you use social media or I should say your smartphones a lot. So one of the things that we discuss or we talk about are overuse disorders. So sometimes, these aren't real medical terms, but what we call selfie elbow, somebody who's always taking a selfie and lifting up the camera. Sometimes that overuse can cause strain to the elbows, to the joints, or text thumb, always texting can cause issues with some of the joints as well. Also, there's something that we call, text neck as well. So always looking down at your phone, that can change some of your, some issues with posture when you do that chronically over a long period of time. That amount of weight that you use when you're putting your head down, it affects the body as well.
So what is the statistics of these cases? I mean, you've talked about the thumb, which I think, I talked about me, and then you've talked about selfie and then the neck. What is the percentage of people who are being affected by the frequent use of these devices?
So we don't have a lot of data on that available to give a rigid statistic about this is the percentage of people, but practitioners are seeing more and more patients coming into their offices complaining about these things. Like I said, these aren't medical terms, but these are things that we are seeing more and more of, and with time, as people do continue to use social media, surely we'll see a rise in it and a rise in chronic problems.
How can these chronic problems be curbed?
I mean, the obvious, reduce the amount of time that you spend on these, on your smartphone, on your electronics. You just have to basically do everything in moderation.
Okay, talking about physical health, I mean, you're a general health wellness expert.
Yes.
What would you say you have noticed in this part of the world that we do wrongly, that when you see it, you're like, don't you know this is going to affect your health?
So one thing is, I think there is not that much awareness on the way that certain medical conditions are actually caused. And by that I mean, when you're just talking about any medical condition at all, when I've had different conversations with various people here, they attribute certain medical conditions to sometimes, like we were talking about, mythical things that have no scientific basis or backing. So one thing I would recommend is with any medical problem at all, there needs to be more awareness. Really understand the cause of why the medical problem is happening, some of the symptoms to look out for, know when to get help and treatment.
Have you tried to work closely with any health institution here? And do you have anything to say about the state of the health system generally here in Nigeria?
Okay, the state of the health system needs a lot of rehabilitation, a lot of rehabilitation. When we talk about healthcare in Nigeria, the main issues usually are access to care. Okay, we need to have a healthcare system whereby when something is wrong, people actually have access to the treatment that they need. So moving forward, they can actually, maintain their well-being. Also, another major issue is there's a lack of preventive services. Usually, in general, everyone should be having an annual medical evaluation whereby they're seen by their medical practitioner, they get their blood work done, and they just check on some key metrics, some baseline metrics to make sure that they're in a general good state of health. A lot of the times I notice here that people wait until it's pretty much too late, and then by that time, it's a critical situation. So health maintenance is key. Screening is key. Screening for certain cancers at various stages of life is key. There are certain things that people are just not doing, and it's not their fault at all, but it's just the way the healthcare system here has kind of been designed. Healthcare in Nigeria needs to be accessible to all people, and it shouldn't be a situation whereby if you need care, you're traveling abroad to get the care that you need. Because guess what? Not everybody has the ability to travel abroad to get that care, and it shouldn't be that way. In the country that you are living in, where you're from, you should have quality care all the time.
Okay, thank you so much for being with us on PlusTV Africa. All right, we've been talking to Dr. Nesochi Okeke-Igbokwe, who is a physician and a health and wellness expert. She's enlightened us on depression and social media addiction. My name is Elsie Godwin. See you soon.